He's Chief Executive of Patient Opinion. And that's, if you don't already know, is an independent online feedback platform for patients. So he's quite nicely on. If you look at the website biography for James, it says he worries endlessly about scalability, usability, and data management, and he's constantly planning new features for Patient Opinion. He's a prolific blogger in long form and on Twitter, and in big demand as a speaker. So James has a background in clinical medicine, public health, and health services research.
Great, thanks Caroline. Thanks so much for inviting me to speak. Morning everybody. So as Caroline says, my background is originally in clinical medicine and public health, but I've been working with the team at Patient Opinion now for the past 11 years. Patient Opinion, I'm sure there'll be a few people in the room who are very familiar with Patient Opinion, so I apologise if I'm telling you things you already know, but I'm sure there'll also be people in the room who are thinking, I've never heard of Patient Opinion, that sounds weird, what's that? So I'm going to assume you know nothing. Patient Opinion is not part of the health service. We're a social enterprise. We're non-profit. We're a small team of 12 people, and we're mainly based in Sheffield. We provide a service that covers the whole of the UK, which looks like this. It's a public website that anybody can use, and we also provide a service across Ireland and in Australia too. The Patient Opinion website is public. Anybody can visit it, and patients come to Patient Opinion to share their stories about their care, about local services, whether they're acute, community, ambulance services, mental health services, and so on. When people post their stories on Patient Opinion, we moderate the story, and then we send email alerts to relevant staff if they're registered on the site, and people respond. And these are real people here who've shared their story about their care, and this fella here is James the podiatrist, who's a real podiatrist who gets lots of feedback in Kirklees about his brilliant orthotics and footwear. And he gets lots of feedback because people really like the care he provides. So currently there's about 160,000 now stories on Patient Opinion from patients and carers. And that includes stories that we aggregate from NHS Choices as well. So we share data back and forth with NHS Choices, which might be a more familiar feedback service to you. Currently, the stories on Patient Opinion have been viewed about 83 million times in total. And you can see there's about 6,000 to 7,000 staff and healthcare students receiving email alerts and listening to those stories. We get about 100,000 visitors a week at Patient Opinion. And we provide services also to education. So we have 5 universities using the stories in healthcare curricula with, for example, nurses, paramedics, physios, OTs, and so on, to learn about what matters to patients. So just to give you a flavour of a story, and I'm aware you guys at the back are going to struggle a bit with this because you're a long way away and the writing's very small, so I'll just explain what's going on here. So this is somebody posting on Patient Opinion about the care of their mum who's had a stroke, and generally she's very complimentary about the care her mum's receiving, and we see that a lot. 54% approximately of stories on Patient Opinion are people saying thank you for great care. This author raises one issue. She says, if I could make one suggestion, it would be if a ward has a patient who's nil by mouth, don't park the food trolley outside their door while serving food, which seems like a fair point to make, doesn't it? A small thing, not what clinicians might think of as a big thing, but an important thing to this patient's mum. She can't eat, but she can smell the food. So here's a response from June, who's a senior nurse in that service, responding back to the patient and saying, OK, we hadn't realised that was a problem, but thanks for letting us know, and here's what we're going to do about it. So it's a thoughtful, empathic, specific response. It's not a general kind of a, thank you for your feedback, it all matters to us. If you would like to make a complaint, here's the number. It's a specific response saying what they're going to do about this specific issue, and explaining how they've learned from the feedback. And that's the kind of response we like to see on Patient Opinion, and it's the kind of response that patients like to see too. And you can see that she's put a change sticker on her response to show that that story has led to a change. And you won't be able to see because you're too far away, but right at the bottom, 3 people have rated that response as being helpful. So June can get some feedback too about her responding on patient opinion. So here's another story. This one also is about food, but this time it's about a more clinical issue because this is a patient with dysphagia who needs a particular kind of diet because they can't swallow. And it turns out the particular kind of diet they need doesn't provide a lot of variation. And in fact, this author is posting about his wife and says that she's been served the same meal twice a day for 6 weeks. And if you try and imagine that yourself, you can see that that might be really upsetting, kind of a problem. And he's asking whether they couldn't perhaps widen the range of meals available for people with dysphagia. So that turned out to be a bit of a tricky problem to solve. Here's somebody responding to it again. It's a senior nurse in that service, and she's responding and saying, okay, we hadn't realised this, but this is a problem, and we are having difficulties with our suppliers in terms of getting the variety of meals of the kind that are needed for people with dysphagia. But then a bit later on, back comes a speech and language therapist on the site, responding again specifically to say, we've been able to widen the range of food available for people with dysphagia who need this particular diet, but it's been a bit of a struggle, but we've done it. So she's posting a very public, accountable response showing that carer's feedback has genuinely led to learning and change, which will help not only that patient, but of course other patients with the same condition. And again, she's put her change sticker on. So everybody can see that if you post feedback about that service, that happens to be in Lanarkshire, then people will take it seriously and your story may lead to change. And that's really important for patients to know. So when we send out email alerts after we publish a story, we send out alerts automatically to people who are listening to particular kinds of stories. That's not just to providers. Actually, we include a whole range of people, depending on who's registered on the site for that kind of story in that area and so on. So you can see, for example, this was a story about a crisis service in Devon, a mental health service. And we sent email alerts not just to the provider, but to the commissioner, to the Health Watch, to the NHS England area team, and indeed to the quality improvement team at the Department of Health. So potentially a whole range of people can hear about the stories that people are telling, and that's also really important to patients, because very often patients feel that their feedback goes into a great big special NHS black hole, and they never hear what happened as a result. So knowing that your story has been read, knowing that it gets a response, and seeing that it's led to some change is a really encouraging and empowering thing, I think, for people when they give their feedback. I was doing some teaching with nursing students at Plymouth a couple of months back. Plymouth uses patient opinion in the nursing curriculum, and I asked the students when if they posted on patient opinion, who would they like a response to come from? And this was what they said. There weren't many takers for the response coming from the comms manager, nor from the patient experience manager or the PALS manager, or even from the chief executive of the organisation. People that these students wanted to hear from, if they posted a story, would be the leader of the team caring for them. And we see that very commonly on patient opinion, actually, that people don't want a corporate response. They want a personal response. They want a specific response. And they want to know that the people that they're talking about, whether their feedback is positive or whether it's more critical, they want to know that the people that they're talking about are actually getting that feedback. And so often we see on patient opinion people saying, thank you to these people on the ward, they made such a difference to my mum's care. Please ensure they see this feedback. And very often we see responses from the NHS saying, thank you for your feedback. If you'd like to make a complaint, please go here. And we really have to get better at doing this. So a big part of our mission for 2017 at Patient Opinion is going to be involving many more frontline staff in patient feedback in real time. So here's an example of that. This is somebody posting about the death of her father. And she has had a pretty mixed experience here. Some things went well and some things didn't. Again, you'll probably struggle to read this. It's quite a long posting, but you can find it on the site if you want to dig in and have a look at the detail. But this person really wanted her father not to die in hospital, but to die in a hospice. And she asked the staff about it, and there were difficulties getting that sorted out, and some communication issues occurred, and in the end he did die in hospital. So naturally she was upset. Actually, the consultant actually came back and responded on the site. It turned out when we talked to the consultant that they'd had quite a battle getting the organisation to agree that they could respond directly on the site. The organisation's view was, well, we've already responded. Our sort of patient experience people have responded to this story, so why do you need to respond? But the consultant's view was, well, it was my care. I looked after this patient, and I want to say how it felt from my perspective. So she did. She got a post on the site, and she talked very honestly and authentically about how she felt about looking after people who were dying and some of the powerlessness that comes with that and some of the feeling of inadequacy, that you can't do what you want to do as a clinician in that situation. And then the author came back and responded back again very thoughtfully to that post. And what was interesting here, looking at this exchange on patient opinion, was the way in which the conversation moved to a conversation that was much more reflective and accepting of one another's points of view. And actually, the author ends up at the end saying, happy to comment on anything else you might want addressed, but overall, let's celebrate a job well done. So we see this again and again on patient opinion, that it turns out that when patients are giving feedback, the NHS often thinks, well, either you're making a complaint or you're donating sort of data. You're giving us data that we can analyse. We're going to turn your story into a dashboard. That's the sort of, flavour of the month at the moment with the health service. It turns out for the people involved in these exchanges, it's not about data at all. It's about relationship. It's about how people feel and make sense of the care that they provide or the care they receive. And this is that consultant then reflecting subsequently on her experience of giving feedback on patient opinion in public, online, unmediated by anybody else. It's not a complaints process. It's an informal process, but it's very visible. And talking about the freedom that she had to respond in a different way, but also how vulnerable she felt, that it was scary to be exposed in that way. But also because it was public, getting a lot of support from her peers on social media, and we see a lot of stories on patient opinion being retweeted, for example, tweeted on Twitter. This particular story was tweeted by the Chief Executive of the Health Service in Scotland. And also talking about the thoughtfulness and the learning that comes out of that, which is very different from a complaints process, because it encourages a kind of a reflection and seeing the world through somebody else's eyes. Again, this is from Notts Healthcare, where they're a big user of patient opinion. They have 800 staff using patient opinion at Notts Healthcare, which is a big community and mental health provider. And again, they don't talk about data and dashboards. They talk about going on a journey which built trust and understanding between their users and their staff, so that people see that their concerns are taken seriously and are being addressed. So that's about building the trust of users in the service, that it wants to hear what people say. And then here's Lisa, who's a podiatrist at Notts Healthcare, talking about, again, not talking about data and dashboards and analysis, but talking about actually empowerment. But what she's talking about is not the empowerment of patients, but the way that getting that direct patient feedback is empowering staff to make the changes that they want to make to improve their service. And that's, again, a theme we see a lot with patient opinion. Staff becoming more confident in their service because they know they're hearing the truth about it from their patients, about how it actually feels. So to sum all of this up, we think the world is changing in important ways. Anthony was referring, and Caroline have referred to this earlier already. The way that social media, these online forms of communication, which are very public, very scalable, are changing the way that organisations need to think about communication. We're moving away from the old notion of organisations broadcasting what they want to say, towards a world in which the organisations or the people in them have to engage in online conversations with users, some of whom are happy and some of whom are very unhappy. But nonetheless, that's a process of moving from many things being hidden to many more things being shared and more open. And it's also a process which is moving from organisations in which very few people are involved in communication to very many people being involved. And if you think, for example, of the contrast between, say, patient opinion and the complaints process is very closed, it's a hidden process, you can't see into it, it's confidential, we don't know what the outcomes are, and it's a process that pits, as it were, the patient against a small number of people handling the complaint in the trust. It's not a process that involves many people in discussion and learning. And fundamentally, I think we're moving towards a world where people see themselves not as passive and happy recipients of care, grateful recipients of care, but towards a world in which they want to become much more active in their care, but also in helping to improve care for other people. And mostly patients' motivations for posting their stories on Patient Opinion are precisely because they want to help make care better. And so what we're starting to see is culture shifting in organisations as they embrace this kind of much more open approach to hearing from and engaging with their patients and carers, shifting towards a culture where staff own their own feedback, they respond to it directly, organisations feel more open. Some staff tell us, for example, when they start using Patient Opinion, that they give one another more feedback than they used to, and more positive feedback than they used to. So in a sense, patients are almost modelling the way that we might all behave, even within NHS teams. From a patient perspective, this feels very different to a standard complaints process. This is a patient responding to a response about a story she posted about a gynae service. And she talks about how her experience was very different from her previous experience of making a complaint. She says she'd encourage any patient who wants to work with staff to engender positive change, which again that is that motivation there you see for improvement, to use Patient Opinion and bypass the stressful and adversarial complaints process. The complaints process is about trying to say who's right and who's wrong, what really happened. Patient Opinion is much more about saying, well, this is how it looked through my eyes, and this is how I felt. What can we do differently? Very often when people look at social media, we see this a lot. They start talking about big data, they start talking about analytics and analysis and scooping up all the tweets in the world and finding out what patients think as a result. And that's certainly one way you can go with social media, is to see it as big data. We find that at Patient Opinion a slightly dystopian view of the future, and we much prefer the notion that actually the stories that people tell, whether through Twitter or Facebook or Patient Opinion or other routes, are actually small data. They're small data about the small things that really mattered, what clinicians often think of as the small things, but actually to patients are the very big things. And it's those specific, personal, humane, small-scale changes I think we need to make in order to make healthcare better, much more than trying to work out what the average patient, the global patient, thinks of healthcare. I think that's going to be an unhelpful way to go. So we're interested not in big data at Patient Opinion, but in small data and small changes that make healthcare better for everybody. And I'll just finish with a quote from Don Berwick's report into patient safety, which came out not long after the Francis report in 2013. He talks about how we need to hear the patient voice at every level, even when that voice is a whisper. That sounds like it might be a hard thing to do, but actually with social media, with online communication, that becomes suddenly a potentially very simple thing to do. We can hear from people who haven't had their voices heard before. We hear from people on Patient Opinion who are depressed, who have continence problems, who are stigmatised in all kinds of ways, who are homeless even, who are addicted to particular drugs, people who found it very hard to get their voices heard in the past. We're doing work currently making it easier for people with dementia to post their stories on Patient Opinion by integrating a picture system. So there are ways that we can hear from more people than we ever had before. And once people tell their story, we can share their story much more widely from top to bottom of an organisation in ways we've never been able to do before. So I'll stop there and very happy to take questions. Thank you.
This, but just to reiterate, the developments that you're going to be doing on your platform, what are your plans for the next developments, the next phase of Patient Opinion? I'd really like to know that.
Okay. We struggle a bit because we have about 10 ideas a week.
Great.
And we can only sort of do about one idea a month in practice because we're quite a small organisation. The things we're working on at the moment, for example, we're integrating the Talking Mat system to make it easier for people with dementia and other cognitive impairments to post stories. We want to extend much more and provide more tools for students, whether they're pre-reg students or or continuing professional development, if you like, learners in practice, to use the stories on patient opinion to support their learning. So we're doing some work around that. We want to engage also with the research community. So there are some research teams currently using the stories on patient opinion to do thematic analyses and so on of different types of care. And we'd like to make it possible for authors to become participants in research. So you might say, well, I need to find 10 people who've had long trolley waits to talk to about what that was like. Maybe I could find those people on patient opinion, and then we could become a mediator of that exchange. So we're doing work around that. We want to involve authors much more in understanding how their story is used. So we're constantly pushing towards creating more transparency on the site as well. We'd like much more scale, although I gave some figures at the start that sounded impressive. They're about 100 times smaller than they need to be for us to actually have a proper impact across the 1.3 million people in the health service. So we've got a lot on our list.
What have you learned about helping PALS and patient experience teams to increase numbers of frontline staff using patient opinion real time? And then another one would be that one.
So this one says, is it this one?
There's two. So there's the top one.
Yeah, so involving PALS and patient experience to increase numbers of frontline staff. I don't think it's necessarily very difficult. Our experience is that when you talk to staff and show them patient opinion, they find it really, really interesting, and they immediately want to know if they have feedback. And then when they see that they do have feedback, they want to respond to it. And so it's not staff who are hanging back, actually, from engaging with this. It's typically organisations being really anxious about who they're going to allow to respond to stories. As you saw in the example of the consultant who had to kick up a fuss before she was allowed to respond to a story about her own care. So I think where we've seen it work best is where people take a very incremental approach, like NOTS. They've been using patient opinion now for 7 years, and they started off with 3 people responding, and then they increased it to 5, and then they started training people, and now they're about 700 people, and they have it as part of staff induction that they learn about patient opinion when they join the trust. So you just gradually do it like that. You can't do it all in a day. You build it up over time.
And then lastly, that one there.
How do we plan to collect the impact over time, okay, on care, patients, professionals of using and interacting with patient opinion? Okay, so this is about impact and whether we can demonstrate it or measure it. And the interesting thing is the impacts are very varied. They're very wide. There's an extraordinary range of impacts that occur for a wide range of people. Of course, because it's public in a way that typically NHS feedback isn't public, that means that the impacts can be very broad. So different people in different places can take different things from the feedback that patients are giving. So staff in the team can take one thing, the chief executive can take another, CQC can take another. They do take all our data, incidentally, and they use it for what they call their intelligent monitoring system. Health Watch can do another thing, and so on. The commissioners can do something else. So there's a whole range of potential impacts. One of the things we're particularly interested in, because this is the kind of people we are, we're really fascinated by as you've probably gathered, by the relationships and the cultural issues, and the impact on the author of actually telling their story. The story I didn't show you, but where you saw us sharing it around the Commission of the Providers, Health Watch and so on, that was a story from somebody who was self-harming and having suicidal thoughts. And she told us a little later on, after she'd shared a number of stories on patient opinion, she said to us that actually she felt that posting on patient opinion had stopped her self-harming. And that was because she felt that she had a voice that she hadn't had before. And she could see the number of people reading her story, because we show you the count of the number of times it's been read. We show authors that. She could see that a lot of people were reading her story. That gave her a sense of solidarity, that people actually cared about what she was saying. And she could see also by looking at other people's stories about crisis, that actually maybe the problems that she was having with her service were not her fault. She'd thought that they were her fault. And she saw that actually other people are having these problems too. Maybe it's not my fault after all. So she started to feel much better about herself, having been able to tell her story. And I think that's an impact that we often forget about when we use this word feedback as if it's a kind of, well, here you are, here's your feedback, So you fill in the friends and family, tick that box. That's not a costly thing, but it's also not a transformative, necessarily impactful thing for people. Telling your story is a very different thing. And it can be incredibly powerful for people to be able to do that. So that's a bit of a long-winded answer, and it probably actually hasn't correctly answered your question, but I'll stop anyway.
Okay, for now with us, we'll break for coffee.
Great.
Thank you very much.
Thanks.